Today, New South Wales recorded 2,482 new infections. To give that number some context, it's a seven-fold increase on what we saw just 2 weeks ago when 325 infections were recorded. Now, the R rate or reference number here is sitting around 2.5. It means for every 10 people who catch COVID, they're giving it to 25 more. There is some good news, though. The hospitalisations are remaining relatively low, about 200 today, and there are 26 people in ICU. So that is the news that New South Wales is focusing on, and very happy to hear that relatively those numbers in hospital are remaining quite low. Yes, and a slight reduction on yesterday's numbers, but of course we are waiting to see how the surge in cases flows on to hospitalisations. Often there is a lag period there. How are the testing lines where you are today? We know there's been huge demand for testing in this state for the past week or so at least. That's right, David. We've seen these long queues of cars snaking along city streets and people lining up in the hot and the wet weather this week to get a test. Yesterday, 137,000 people in the state did get tested, and there has been pressure on the system. We did ask New South Wales Health if it had any plans to expand testing capacity, and it says while it does have a plan in place, they can bring in more staff and extend hours. It's not a measure that they've announced that they're looking to do that at this point in time. Yes, despite the rise in cases, 72 hours of isolation for international arrivals has been scrapped in New South Wales. David, it's a welcome move for anyone travelling home from overseas this Christmas. They would have had to isolate for 72 hours. Now the requirement is to get a PCR test within the first 24 hours of arriving here in Australia. But it's a very interesting contrast between what the government is doing in terms of easing restrictions this week. We saw mask mandates dropped and QR codes dropped for most settings earlier this week in New South Wales, with what the state's health department is doing, which is reintroducing restrictions in hospitals and a number of settings. Hospitals have in fact been placed on red alert, which means visitor numbers will be greatly reduced and staff required to wear PPE. So it's an interesting contrast there, David.